Headaches are incredibly common. Almost everyone experiences a headache at some point in their life. They can range from a mild annoyance to a debilitating problem. Understanding the different types of headaches can help you know how to manage them and when to see a doctor. The most common type of headache is a tension headache. These headaches are often described as a constant pressure or tightness, almost like a band squeezing around your head. It feels like a tight band or pressure around your forehead. This sensation can be quite uncomfortable and distracting, making it hard to focus on daily tasks. You might also feel spasms around your eyes and upper neck. These muscle contractions can add to the overall discomfort and make the headache feel more intense. The pain is usually a dull ache that can worsen throughout the day. As the day progresses, the headache can become more severe, especially if you're under a lot of stress. Tension headaches are often triggered by stress, fatigue, and poor posture. Long hours at a desk or staring at a computer screen can contribute to the onset of these headaches. Fortunately, they can usually be relieved with over-the-counter painkillers. Simple medications like ibuprofen or acetaminophen can be very effective in reducing the pain. However, it's important not to rely on painkillers too often, as overuse can actually cause more headaches. This condition is known as medication overuse headache, and it can be quite problematic. Regular stretching, physical activity, and stress management techniques can help prevent tension headaches. Incorporating these habits into your daily routine can make a significant difference in reducing the frequency and severity of headaches. Sinus headaches are caused by, you guessed it, sinusitis. Sinusitis is an inflammation of the sinuses, air-filled cavities in your skull. Along with a headache, you might experience pain and pressure in your cheeks, eyebrows, and under your eyes. Sinus headaches are also often accompanied by a fever and facial swelling. The pain usually worsens when you move your head suddenly. Sinus headaches are often linked to colds or allergies. Treatment for sinus headaches depends on the cause. Antihistamines can help with allergies, while antibiotics might be needed for bacterial infections. Section 4. Migraines. Migraines are much more intense than tension headaches. They are a neurological condition that can significantly impact daily life. They can cause throbbing pain, usually on one side of the head. This pain can be so severe that it interferes with routine activities. This pain can last for several hours or even days, making it difficult for sufferers to maintain their normal schedules. Migraines often have 4 stages: prodrome, aura, headache, and resolution. Each stage has its own set of symptoms and challenges. The prodrome phase happens hours or days before the headache and involves symptoms like irritability, fatigue, and appetite changes. These early signs can serve as a warning. The aura phase involves sensory disturbances like light sensitivity, tingling, numbness, and even speech problems. These symptoms can be quite alarming. Not everyone with migraines experiences auras. However, for those who do, it can be a very disorienting experience. The headache phase is the most debilitating, often accompanied by nausea, vomiting, and extreme sensitivity to light and sound. The resolution phase involves lingering symptoms like trouble concentrating, fatigue, and a general sense of being unwell. The exact causes of migraines are unknown, but they are believed to be related to changes in the brain, including temporary changes in blood flow and nerve signaling. These changes can be triggered by various factors such as stress, hormonal changes, certain foods, and environmental factors. There is no cure for migraines, but various treatments can help manage the symptoms and reduce the frequency and severity of attacks. These treatments include over-the-counter pain relievers, prescription medications, and lifestyle changes such as stress management and dietary adjustments. By understanding their triggers and working with healthcare providers, individuals can find effective ways to manage their migraines and improve their quality of life. Section 5. Cluster headaches and hangover headaches. Cluster headaches are rare, affecting less than 1% of the population. These headaches are often misunderstood and misdiagnosed due to their rarity. They are characterized by severe stabbing pain on one side of the head, often behind or around the eye. This pain can be so intense that it is often described as the worst pain a person can experience. These headaches occur in clusters, hence the name, with multiple headaches happening over days or weeks. Each headache can last from 15 minutes to 3 hours and can occur several times a day. The pain is often described as excruciating and debilitating. Many sufferers find it difficult to carry out daily activities during an attack. Hangover headaches are a common experience after drinking too much alcohol. They are usually a result of dehydration and the toxic effects of alcohol on the body. They are usually a dull, throbbing pain accompanied by nausea, fatigue, and increased sensitivity to light and sound. These symptoms can make it difficult to function the next day. The best way to prevent a hangover headache is to drink alcohol in moderation or avoid it altogether. Staying hydrated and eating before drinking can also help reduce the risk. If you experience frequent or severe headaches, it is essential to consult a doctor. Persistent headaches can significantly impact your quality of life. Headaches can be a symptom of a more serious underlying medical condition. Proper diagnosis and treatment are crucial for managing your health. A doctor can help you determine the cause of your headaches and recommend the best course of treatment. Don't hesitate to seek medical advice if you're struggling with headaches.